Thank you very much, Dr. Barber. Our next presenter, a graduate of the University of the West Indies, Mr. Pir Nasir holds a Bachelor of Science degree in both chemistry and biochemistry. He holds certifications as a certified strength and conditioning specialist and completed his Master of Science degree at Smith College in Massachusetts. Mr. Nasir is currently a doctoral candidate at Spring College in Massachusetts. Mr. Nasir is a senior lecturer in the Academy of Sport at the University of Trinidad and Tobago, where he presents lectures in the areas of exercise physiology, exercise prescription, care and prevention of injury, nutrition and performance, and sports psychology. Mr. Nasir will present today on the epidemiology and etiology of volleyball injuries and implications of coaching. And what better person to present from the viewpoint of a coach? Mr. Nasir is one of our more qualified volleyball coaches with over 20 years experience. He spent 6 months in Germany at Leipzig University, where he obtained his certificate in volleyball training. In addition, he has the Federation of International Volleyball Levels 1, 2, and 3 coaching certifications. Mr. Nasir also served as the assistant coach of women's volleyball at Smith College for 5 years, where he then transitioned to head coach of men's and women's volleyball at Mount Holyoke College in Massachusetts for over 3 years. He even spent time as our national volleyball coach and continues to coach A-Division volleyball here in Trinidad and Tobago and serves in the capacity of head coach and director at the Zenith Volleyball Club. Ladies and gentlemen, here to present to you the epidemiology and etiology of volleyball injuries and implications for coaching, Mr. Pir Nasir.
Thanks, Dr. Dalloway. Before I start, I realize that Dr. Kerry Dalloway has been introducing everyone and nobody has introduced him. And since he's a colleague in our department at UTT, I thought I would do a short description. Dr. Kerry Dalloway is also a professor in the Academy of Sport and Leisure Studies at UTT. He is one of our few doctorate in physical therapy that we have in the country. And we're very proud to have him at UTT. Dr. Kerry Dalloway, thank you very much. So let me start by saying, thanks to the organizers of the conference at UE. Just as a side note, our sports department is interested in hosting a conference as well. So we want to learn, as in Trinidad we say Mako, as much as we could from this conference so we could hold a successful one, as successful as this one seems to be. So thanks to the organizers at UE. The other distinguished guests and most of all, our distinguished panel that we have gathered here today that UE has brought together. I'm very humbled and happy and pleased to be among such distinguished company to present on some of what I have gathered. So in the field of sport, we have all this data that our good researchers, scientists, and doctors have produced. But most of the times, we don't know what to do with it, or what are the implications of all this data and all this great information that we have presented to us. And that is the perspective that I'd like to take today as a coach. And as a coach, I want to know what are the implications for coaching. So, so with that in mind, I will go ahead and start the presentation. The title is The Epidemiology and Etiology of Volleyball Injuries and Its Implications for Coaching. So we'll do an introduction. We'll talk a little bit about the epidemiology, then the etiology, and then most importantly, as coaches, what does that mean to us? So to introduce you, volleyball is a dynamic sport. I'm sure many of us have seen it on TV and seen it in real life. And volleyball has exploded in Trinidad right now, fast becoming one of the top sports. And because of the nature of volleyball is a very dynamic sport, and because of this, you have lots of large movements and lots of large forces being generated. And as one of our panelists mentioned earlier, Dr. Gopi Singh, I think, when he was talking about the mechanisms of injuries, he went through the long list, and one of those things was the forces. How do injuries really happen? And in volleyball, we have a lot of those. Then we talk about epidemiology, and epidemiology is the study of the patterns of diseases. So you want to know what are the patterns, how many diseases, how many injuries, like in this particular case, injuries. How many injuries do we have in volleyball? If we don't know that, we don't know how to prevent it. And in volleyball, the injury rate was 4.58 for games and 4.10 for practices per 1,000 athlete hours. What does that mean? An athlete exposure, is one athlete in one training session. That makes an athlete exposure. So we want to look at, if for example we have 10 athletes in a training session, then it will be 10 athlete exposures. And then the number of training sessions we have per week, and then per month and per year. And this is how they accumulate the injury exposure rate. So what was found was that of all these injuries, ankle inversion injuries was the most prevalent. That was followed by knee injuries, lower back injuries, etc., etc. But since ankle injuries were the most prevalent, we thought that for the purpose of the conference and the purpose of brevity, that we focus on the ankle inversion injuries. When we talk about etiology, we talk about how do injuries actually occur. And Dr. Gopi Singh put on a very nice slide about the actual mechanisms of injuries. Again, to break it down for coaches, it's very simple. Of course, they have the outside and inside factors and all that. But for an injury to occur, there has to be a force that is greater than your body could withstand. That's the simplicity of it. So once there's a force greater than the athlete's body system could withstand, you get an injury. And that is what we have to try to prevent. Now, where do these injuries occur in volleyball? It occurs at the conflict zone. In volleyball, we talk about the conflict zone. Now, volleyball is a non-contact sport, and athletes rarely come into contact with their opponents, except by the net. And not only by the net, you jump and land by the net. And this is where a lot of the injuries happen. Which brings us to the implications for coaching. So, how do we, knowing what the incidents of injuries are, knowing how they occur, we have to know how to prevent them. And from a coaching perspective, this is what we have to bring back to our practices. So, what the researchers have found, the researcher who did primary research in this was Pedowitz. And a lot of the data came from the US study. But what Pedowitz found to decrease his injury rates was several things. One, actual coaching technique. He found that if he could improve the players' jumping and landing technique at the net, it decreased the injury rate. And in his study, it decreased it by 30%, which was very notable. So that was the first thing, to teach proper technique. A lot of times, in Trinidad especially, when you look at the game being played, not only volleyball, other sports as well, you find that a lot of young people coming into the game use poor technique or incorrect technique. And this contributes a lot towards getting injured. So that was one thing. The other thing that he did was coaching side-to-side movement, because not only spiking but blocking also causes some of the injuries at the conflict zone. So he also taught people to move effectively to the side and jump straight up and down so that he wouldn't land on their teammates and therefore roll their ankles or invert the ankles. The other thing that Pedowitz came up with was a proprioceptive program. And again, for coaches, proprioception has to do with your neuromuscular system, your nervous system, and detecting the changes in the tension of your muscles and your joints and the position of your muscles, of your body parts in space. What's a good way to improve proprioception is by doing balance work and stability work. And this was one of the ways that Pedowitz was able to decrease the rate of injuries. How proprioception works as well, it causes the use of muscles that pronate and supinate the feet. Normally in everyday life, we don't use those muscles, except when we try to perform sports and do the skills and whatnot. So by engaging these muscles outside of those sessions, it helped. And of course, it stimulates multiple planes of ankle movement. And the third thing that Pedowitz came up with was the bracing program. And in volleyball, if you observe carefully, you will see people playing with actual ankle braces. And these ankle braces are designed not only mechanically, that would stop the ankle from rolling, because it's called a semi-rigid stirrup type brace. It does not only stop the ankle from rotating, but it also helps with the proprioceptive system, where you actually feel the brace against the side of your feet. So you actually feel the brace so that you feel when your ankle rolling. And this was something else that he found. And these are the list of references of all the studies that we looked at to come up with this information. In closing, I wanted to bring a take-home message to the audience. My work is primarily as a coach and as an instructor, a PE instructor. And my role is to help educate the general public, the general playing public and the general coaching public about what we could do to decrease injury rates. If you notice, I didn't perform the research or didn't perform the experiments. All I did was research it. And this information is available to everyone across all sports. We do have any data available for volleyball in Trinidad, so I'm hoping that the good doctor and his team and our other distinguished panelists could do some research. And he talked about the model, the 4-stage model. And this is based on that as well, the 4-stage model, where you find out what the injury is, how it occurs, how to prevent it and evaluate it. And that is the model that we want to use. So, and the injury patterns are similar around the world. So this is primarily from a US source and a Scandinavian source. So we as coaches could find this information, it is there, and incorporate it into our own practice. All right, thank you very much.
Ladies and gentlemen, please let's thank our distinguished panelists again for their presentations. It's great to know that such a wonderful research in the area of sport medicine is actually coming out of Trinidad and Tobago. And hopefully as time goes on, more persons will get involved and we'll get more data coming out so we can help prevent injuries in the future. We'll now like to open the discussion where we invite the audience to send some of your questions toward our distinguished panelists. Right, we have like 10 minutes or so we have the young lady here, you can go ahead.
research instrument. I know it's a pilot research. Why did you only use 2 swimmings to assess swimmers for that short period you had? You said you had 3 months. Was there a particular reason?
That's the question. You guys can hear me? Yeah? Okay, great. It was primarily for our primary researcher's thesis. He's in Germany, and he was doing his master's in medical science. And he had the time limit, so that actually was the primary limitation there.
Any other questions?